My name is Sarah Hovey, and I'm a registered massage therapist and a registered cranial sacral therapist. And I'm one of the instructors at the Langara College Cranial Sacral Therapy training program. I'd like to talk just a little bit about what is cranial sacral therapy and how did it come about. And one of the simplest things that I say to people is that craniosacral therapy is treatment for injuries. And it could be any kind of injury, whether it's something that happened just this morning or something that happened 10, 15, 20, 30, 40, 50 years ago. It's a light touch kind of therapy, and it's developed out of cranial osteopathy. And cranial osteopathy was first, I can't even say discovered, it was first developed by William Sutherland. He was an osteopathic college in 1899, so this has been around for a while, and he had the inspiration looking at the bones of the cranium, the bones of the head, where he thought that they were being taught, of course, that the head was fused, the bones of the head were fused, and he looked at the head and he thought, you know, those bones, those sutures look as though they were made for some kind of movement, for some kind of respiratory motion. So over the next 55 years, he died in 1954, he developed what became known as cranial osteopathy. And other osteopaths practiced it, and it developed in a couple of different directions. And then in the early 1970s, another American osteopath came across cranial osteopathy and started to do his own work and his own research. And he was the first one, John Upledger, who actually started to teach craniosacral therapy to non-osteopaths, and took a fair bit of flack for that. But if he hadn't done that, then people like me, an R.M.T, would not actually be able to practice it in these days. So one of the ways to talk about craniosacral therapy is how does it actually work? It's a light touch therapy, as I've said. It's hands-on, and it's manipulative, but it's manipulative in the most subtle of ways. When I first was learning this, I was thinking that you had to be some kind of a psychic or intuitive to be able to do the work. I was so impressed with how it looked as though the therapists weren't really doing much of anything, and yet quite profound changes were happening. But what I've learned is that it's actually subtle palpation, is that as you learn to do this, and it takes quite a while to develop that, the subtleness of the touch, as you learn to do this, your touch becomes more and more subtle so that you can perceive things happening in the body. And what we're feeling for is we're feeling for the motion, the subtle motion in the body. Is it regular or is it irregular? Is it compressed in some way or strained in some way, or are things just not moving on this most subtle of levels? And the actual work is connecting in with the body's self-healing mechanisms so that the body can repair itself. So we're not actually doing very much. We're working with the body so that it can actually do the work itself. And it is both extremely rewarding and very fruitful. I've worked with all range of different kinds of difficulties that people had, everything from, you know, headaches, car accidents, back pain, ringing in the ears, TMJ problems, traumatic brain injuries, all kinds of things. And the work, because it's so subtle, it goes in what's called under the radar of the body, so you're not activating the nervous system the way sometimes more manual techniques can do, and you're really helping the body just to settle and heal. The work is very, very rewarding, and I think the training at Langara College is an excellent way to learn this work because of the way that we string the whole program together into one 10-month-long session. Thanks.